What if you have an orgasm but no semen comes out? Should you be worried? Hi everyone, welcome back to my channel. I'm Dr. Semen, and today we are talking about a condition that many men experience but rarely talk about: retrograde ejaculation. Normally, when a man reaches orgasm, semen, a white fluid that contains sperm, is released through the penis. But in retrograde ejaculation, semen doesn't come out through the instead. It flows backward into the bladder. Because of this, a man can still have an orgasm, but may notice very little semen or no semen at all. This is often called a dry orgasm. So, how does this happen? During ejaculation, sperm travel through a tube called a vas deferens to the prostate, where they mix with other fluids from semen. At the same time, the muscle at the neck of the bladder closes tightly. This is very important because it prevents semen from entering the bladder and directs it out through the penis. In retrograde ejaculation, this bladder neck muscles doesn't close properly. As a result, semen travels into the bladder instead of leaving the body through the penis. So, what can cause this problem? Several conditions can affect the bladder, neck muscle, or the nerves that control it. These include diabetes, spinal involving the prostate, bladder, testicles, colon, or lower spine. Some medications can also cause retrograde ejaculation, including certain medicines used to treat and enlarge prostates and some antidepressants. What are the symptoms? The most common signs include little or no semen during orgasm, cloudy urine after orgasm because semen mixes with the urine, and difficulty getting a partner pregnant. It's also important to know that if a man has several orgasms in a short period of time, it's normal for late ejaculations to produce much less semen. That is not the same as retrograde ejaculation. However, it can become a problem because for couples who are trying to have a baby, because the sperm doesn't leave the body in the usual way. If you repeatedly notice that no semen comes out during orgasm, it's a good idea to see an urologist. Your doctor can find the causes and recommend treatment if it's needed. Finally, here is a very important point. Some people think that if no semen comes out, there is no risk of pregnancy or sexually transmitted infections, so they stop using condoms, but that's not true. Small amounts of sperm may still be present in genital fluids, and sexually transmitted infections can still be passed from one partner to another. That's why practicing safer sex is still important. Thank you so much for watching. I hope this video helpful. Please subscribe, like, and comment on video. I'll see you in the next video. Take care and goodbye.